Assalamualaikum and hi, I'm Anisha Patini, Bintang Magazine, and my student ID is 202350205. And my group members are Farizwan that will explain about objective, method and conclusion, Abdul Fatah Limi that will explain about result, and Fatih Hamizah that will explain about discussion. I will continue to the introduction part. The amalgam is a mixture of silver, tin, copper and mercury, which is commonly used in dental procedure and stands as a prominent source of mercury exposure for the population. The amount of mercury exposure varies based on the number of dental amalgam installation a person has, from 3 to 17 micrograms per day. Due to its high mercury content, there are ongoing efforts to reduce the use of dental amalgam in dentistry. One of the primary concerns regarding dental amalgam is the release of mercury from fillings over the time. Even the application of a single amalgam filling can lead to a notable increase in mercury levels in saliva and blood within a few hours, followed by increased excretion of mercury in urine. Moreover, dental personnel are at risk of inhaling or being exposed to mercury through the skin during procedure involving dental amalgam. Monitoring has shown that nearly half of the dental workers have elevated mercury level in their urine, indicating occupational exposure. Thus, regulations such as EU Regulation 2070/852 aim to decrease the use of dental amalgam and explore the possibility of a CE out entirely by 2013. To protect both dental practitioner and patient, measures such as using pre-dose encapsulate dental amalgam and installing amalgam separator are recommended. There is also a proposal to ban the use of mercury in bulk form by dental practitioners and restrict amalgam use for certain groups like children and pregnant women unless medically necessary. That's all for me. Thank you.
My name is Faiz Rizwan. For objective of this article is to assess the health risk associated with mercury exposure from dental amalgam restoration. The second is to determine the total mercury content in biological samples like urine and hair, and to evaluate the relationship between the number of amalgam filling and the concentration of mercury in this biological sample. Next, for the methodology of this article, the instruments that they use is atomic absorption spectroscopy (AAS) AMA254 with vapor generation technique at 254 nanometer. Second is ultraviolet visible UV VIS lambda 2S spectrophotometer. The standard reference is Serenum TE whole blood L-1, and the procedure of this experiment is: first, the study assess mercury exposure in dentists and patients with amalgam restoration using biological samples, which is urine and hair that collected during winter and spring months in 2017 and 2018. Next, the total mercury in the samples was determined using atomic absorption spectrometer AAS AMA254. The hair samples were collected from the back of the head and processed according to IAEA procedures. Third, the urine sample were collected in plastic container and analyzed for creatinine using the Jeff reaction. And lastly, the simple linear regression was used for data analysis to examine the relationship between the number of amalgam filling and mercury concentration in urine and hair.
Hi, I am Fatah. So as for the result, the total mercury content in urine and hair, the number of sample is 50, which is 40 for dentists and 10 for controls. So as for the number of amalgam fillings, like dentist has an average of 4.3, which range from 0 to 12, while control have the average is 1.7, which is ranging from 0 to 7. So for the total mercury concentration in urine and both hair is the total mercury content in urine is about, the mean is about 3.05 microgram per gram, while for the control is 0.55 microgram per gram. As for the mercury concentration in hair, the mean for the dentist is 0.377, as for the control is 0.233. So this show that a dentist has a higher concentration of mercury compared to the controls. Then simple linear regression was done for data analysis to investigate the relationship between the number of amalgam fillings and also the concentration of mercury in both hair and urine. So the correlation analysis was done to show the relationship is strong or not. So analysis of mercury in urine shows that the correlation coefficient for both dentist and control is 0.39, which is medium, while the correlation coefficient for dentist only is only 0.33 and 0.72 for non-occupational exposure, which is controls. For analysis of mercury in hair, the correlation coefficient for both dentist and contour is 0.07, which is really weak, while the correlation coefficient for dentist only is 0, which is not, and the correlation coefficient for non-occupational exposure is 0.08. So this graph shows the correlation coefficient or simple linear relation that was done for both urine and hair. So as we can see in urine, the gradient which is more steeper compared to the in the hair because of the stronger correlation coefficient in urine compared to the hair.
Hi, my name is Fatin Hamiza and I will continue explain about discussion. Mercury concentration in biological samples, which is urine and hair, are quantitatively measured using atomic absorption spectroscopy, which is AAS, with mercury vapor generation. This provides precise numerical data on mercury levels. The data obtained from the study indicate that current dental exposures to mercury do not exceed acceptable risk levels for dental personnel and patients. The mercury levels in urine and hair samples were found to be below the biological limits for occupational exposure, suggesting that the current use of dental amalgam is relatively safe under monitored conditions. Next, the advantages. High sensitivity and specificity. The use of AAS with mercury vapor generation provides highly sensitive and specific measurements. Speed and efficiency. The method allows for rapid analysis with a total analysis time of approximately 5 minutes per sample. Limitation. Sample size. The study sample size is relatively small, which may limit the generalizability of the findings. Next, accuracy. The study used standard reference materials for quality control, ensuring accurate measurements. Precision. The method demonstrated high precision with consistent results across repeated measurements. Sensitivity. The detection limit for mercury was 0.1 microgram over liter, and the limit of quantification was 0.3 microgram over liter, indicating high sensitivity. Detection limit. The low detection limit allows for the identification of trace amounts of mercury in biological samples. Robustness. The technique is robust, withstanding variation in sample preparation and analysis conditions without compromising the results. Importance of analyzing the analyte from the sample. Analyzing mercury in biological samples such as urine and hair is crucial for assessing exposure levels, especially in population at risk due to dental amalgam. Determining the total mercury concentration helps identify potential health risks associated with chronic exposure. This analysis provides a clear picture of the mercury burden in the body, allowing for the evaluation of both occupational and non-occupational exposure. In this study, mercury levels were measured to understand the impact of dental amalgam fillings, which are known source of mercury exposure. Explanation of why the spectroscopic method is chosen compared with other methods. The spectroscopic method, specifically AAS, with mercury vapor generation was chosen for its high specificity, sensitivity, and reliability, allows for accurate detection and quantification of mercury at low concentration, which is essential for evaluating exposure levels in biological samples. Compared to other methods such as colorimetric or electrochemical techniques, AAS offers superior precision and lower detection limits, making it ideal for trace analysis of mercury.
In conclusion, do not exceed the acceptable risk level for dental personnel and are below the biological limit of mercury in urine valid for occupationally exposed person. And then, the study found a tendency for the concentration of total mercury in the urine of individuals to correlate with number of amalgam filling in the oral cavity, supporting the view that amalgam fillings are a permanent source of mercury exposure.